everyone, I am Lourdes Jane Hordista Renablas, a Level 1 nursing student from the University of the Visayas. And in this video, I will be performing my return demonstration for administering intradermal injection. Medication is a substance administered for the diagnosis, cure, treatment, relief of symptom, or for the prevention of disease. Intradermal injection is the administration of a drug into the dermal layer of the skin just beneath the epidermis. The purpose and significance of administering intradermal injection is to provide medication that the client requires for allergy testing and TB screening. Perform hand hygiene. This is done to prevent the transmission of harmful pathogens during the administration of healthcare. Next is to prepare the medication ampule for drug withdrawal, which I did earlier on a separate return demonstration video. This is done to save time and effort and to carry out tasks in a systematic manner. Next is to introduce yourself to the client and verify the client's identity. Mayong adlaw, sir. Ako di si Jane, imong student nurse. Pwede ko mangutana, unsa ganito'y pangalan nimo, sir?
Rinaldo Renoblas.
Okay, sige. Salamat, Sir Rinaldo. This is done to ensure that we are carrying out the correct procedure with the correct client. Next is to explain the purpose of the medication and why it is important. Sir Rinaldo, ang skin test ato ni siyang pagkabuhaton aron madeterminar kung aduna ba kay allergy sa maong tambal ngadtong idapat nimo. Kini maghimo og gamay nga butoy sa imong panit ug kini hapdos gamay. Nakasabot ra ba, sir?
Oo, nurse.
Okay, sige, salamat, Sir Rinaldo. Providing information to your client will minimize anxiety and fear, will foster trust, and will promote client cooperation. Next is to provide for client privacy. If you are in a ward, be sure to place curtain drapes around the working area. If you are in a private room, be sure that the doors are closed and adjust curtains if there are any. Providing privacy is the client's basic right. Through this, we can establish rapport and promote client's comfort and cooperation. Next is to select a site. But for this return demonstration video, I will not be able to inject the medication directly into the client's skin without the supervision of a registered nurse. So instead, I will be using a synthetic skin. Good visualization is necessary to establish the correct location so as to prevent damage to the tissues. Next is to clean the site with an alcohol swab. This is done to remove pathogens away from the injection site so as to prevent contamination. Next is to remove the needle cap while waiting for the alcohol to dry, since it might take a while for the alcohol to completely dry. Next is to expel air bubbles from the syringe, since air in larger amounts can act as an air embolism, which is dangerous to the client. Next is to grasp the syringe close to the hub, holding it with your thumb and forefinger. This will prevent accidental loss of medication. Next is to hold the syringe or hold the needle almost parallel to the skin with the bevel of the needle facing up. This prevents accidental needle stick and the inadvertent unscrewing of the bevel from the barrel of the syringe. Next is to hold the patient's skin and pull tight until it is taut. This facilitates needle entry, which in turn minimizes the patient's discomfort. Next is to insert the needle far enough until the bevel is through the epidermis into the dermis. This facilitates effectiveness. Next is to stabilize the syringe and the needle and inject the medication slowly and carefully. Rapid injection can cause speed shock. Next is to withdraw the needle quickly at the same angle at which it was inserted, since withdrawal of the needle may be uncomfortable to the client. Do not massage the area of the injection because of the medication's anticoagulant action.